but it wasn't broken, so that was good. But she was panicking like this whole time.
The shame of
Good morning, everyone. Thank you for joining today's event here at the Bipartisan Policy Center. Whether you trekked through the rain or are sitting comfortably at home or in your office, for those online, thank you for joining us, and we're glad you could be part of the conversation today. Today, we're going to focus on an area where there is great bipartisanship. It's an area where Democrats and Republicans have been coming together, and it's called evidence-based policymaking. Whether folks are Democrats or Republicans, our elected officials, our policymakers, want our government to work better. That's what evidence-based policymaking seeks to do: provide information that can inform key decisions that ultimately improve people's lives. I'm Nick Hart. I lead an initiative here at BPC called the Evidence-Based Policymaking Initiative, and we launched it about a year ago. This initiative grew out of a federal commission called the U.S. Commission on Evidence-Based Policymaking, and that commission specifically led a charge to encourage the routine use of evidence to inform effective public policy. The commission issued its final report just about a year ago, and it was bipartisan and it was unanimous. So every Republican, every Democrat that was on the commission agreed to its findings and recommendations. The proposed recommendations were about making better use of the data that government currently collects, stronger privacy protections, and ensuring government has the capacity to actually generate and use evidence. We're now happy to say action is underway to implement 22 of the recommendations from the commission, but there's still a lot of work to be done. And importantly, the commission was primarily interested in federal government issues based on the charge it was given by the president and Congress. While there's been a lot of discussion about the federal government over the last year in terms of better using data and evidence to inform decision-making, we must be clear that this isn't just something to talk about for the federal government. There's also a recognition that the same concepts, the same approaches are useful and relevant for local governments, for counties, for tribes, for territories, and for states. The Commission on Evidence-Based Policymaking recognized that for federal evaluation, states actually play a really critical role, sometimes collecting the data that are used for the evaluations, and in many cases operating the programs that are being evaluated. The focus is more on, today, what states can do moving forward, and less on the role of the federal government. So as a quick aside, I keep saying the term evidence-based policymaking. For those of you that may be less familiar with the terminology or precisely what I mean, you may not be alone. We're not going to ask for a show of hands from folks in the room, but when I talk to my parents and say, I support the use of evidence in policymaking, their response is generally something like, don't we already do that? If I was to talk to my brother in Ohio or my sister-in-law in Indiana, they would probably have a very similar response. Don't we already use evidence to make policymaking? We know it's actually much more complicated than that. And for those of us in the field, it's not just about a bunch of buzzwords on a page. It's actually a really important set of concepts to incorporate in everything that government does. So to help clarify today, the Bipartisan Policy Center is releasing a primer that explains what we mean when we say evidence, what we mean when we say evidence-based policymaking, and why it's relevant for government and for the American public. So for those in the room, it's outside on the table. You may have grabbed it on the way in. For those online, you can go to our website, bipartisanpolicy.org/evidence, and find a copy. Here's the really short version of what we mean. What government does is really important. We want our government to be as effective as possible in addressing the problems facing our society, whether it's about market failures or inequities or healthcare crises, better economic development, criminal justice programs, whatever the issue is, we want these to be effective. In order to do that, policymakers need good, reliable, timely information on which to base their decisions. Not doing so means there's a risk of ineffective, inefficient, costly programs that could actually be harmful if implemented in a way that negatively affects people's lives and their well-being, and that's a problem. So having and using good information to make decisions is how we address complex questions to fulfill the promises that government makes. It's how government can ensure that problems it seeks to address are actually addressed. And this includes everything from data collection to analysis of data, and eventually, and hopefully, the use of the analysis to make a decision. But we can't use evidence that doesn't exist, and that's one of the things we're going to talk about a little bit today. Today we focus on states and territories and how they grapple with evidence-based policymaking in the context of state decisions. We'll talk about the challenges. Why is this so hard to do across the country? Sometimes it's a lack of data infrastructure. It's not the most enthralling topic. It's not the most exciting thing to talk about, but it's really important to have a good data infrastructure. If we're going to analyze data, we have to collect those data in the first place. We have to have the people and the resources in place to conduct analyses in a meaningful and high-quality manner. Some states have built really great systems. Things like the state longitudinal data systems that we use for workforce and education analysis. Some of these systems are more advanced than others. But in some cases, across some programs, the systems to collect data and store data that are ultimately relevant for the analysis don't exist, or they're not built in the way that's necessary to use for evidence-based policymaking. I know of one state that still hasn't digitized its state child support records. They're using paper copies, so it's pretty hard to get the data into a system to analyze. We just converted all the systems for hazardous waste management. Historically have used an 8-copy, carbon copy form to track hazardous waste shipments, and it's just being converted into a digital system. So across the country, across the states, we still have a number of legacy systems that make a lot of challenges when it comes to data infrastructure. Sometimes even when we have the infrastructure in place, access to those data can be unintentionally limited. And we know that combining data across programs is sometimes a challenge. Memoranda of understanding can take too long. Data collected by one program can be useful and relevant for another, but inaccessible for a number of reasons. How do we securely bring these data together without introducing new privacy harms? How do we bring these data together across agency silos that are ill-equipped for interagency data sharing? And how do we convince the lawyers that all this is legal while we're talking about doing it? Sometimes there are other issues like an absence of sustained leadership in state and local governments. It takes a motivated leader to address many of the systemic and legal interpretation issues that can be faced in agencies that relate to using data. Governors can play a big role here. State legislatures can play a big role. The staff of governors' offices, the senior staff in agencies can all send signals that the use of data for evidence-based policymaking is really important, that they want evidence, that they need evidence, and that the generation should not just be encouraged for the sake of conducting research, but that it's actually a critical element of running a good government. It can be as simple as asking a question. What evidence do you have to substantiate this program? How can we make it better? What does the research say? What does the data suggest? But the leadership isn't always from the top. Sometimes it's from the bottom of an organization. Career civil servants can band together and really encourage innovative changes across government agencies from the bottom all the way to the top. And in reality, we need some combination of top-down, bottom-up leadership in order to be successful in this field, because change is hard. And ultimately, we're talking about a culture change across governments. So if we're going to see this change in culture across agencies and encourage policymakers to incorporate evidence, it's going to take more than one person, and we know that. During the course of this event, we'll highlight some of the opportunities and talk about how we harness the lessons that have been learned across innovative practices that we've seen in some states. If anything, the question that we might pose about the federal government is, how can the federal government actually support states in engaging in this work? The National Center for Health Statistics, I know there are a bunch of folks from the Centers for Disease Control watching online. The NCHS has built a really amazing infrastructure around vital statistics, births and deaths. And we use those in analysis to generate really profound insights. I know NCHS is a federal agency, but this is a program that was built on a really productive and powerful set of partnerships with states. Every state across the country participates. Those data are collected by states in partnership with NCHS, and it raises the question, what kinds of partnerships do we need to build better in this field across states? Most states have some form of welfare or human services waivers in place, whether it's for Medicaid or child support or child welfare. And these are federal programs, but they have major implications for state decision-making. Are waivers a path forward for encouraging innovation across the states and for testing new ideas? There are dozens of policy labs across the country, some in partnership with land-grant universities, one in partnership with the government that we know of. And these aim to bridge the gap between researchers and policymakers by providing timely and relevant evidence that can be useful for decision-making. Do we have enough policy labs? Do we need more? Is the structure that these are in place, does it make sense? There's also an increase in the use of what we call social impact bonds or pay-for-success contract models, and these offer short-term gains in determining whether government services offer real and substantial improvements for outcomes of interest. How do we translate those into long-term gains as opposed to simply short-term? We'll also talk today about how to incorporate evidence-based policymaking better at the state level of government. The field of evaluation is nascent across many states. Few states have formal evaluation policies in place across their executive branches. So how do we build a stronger evaluation infrastructure across the country at the state level? How do we encourage policy diffusion of the promising practices for building a culture of evidence throughout the country? And what are these promising solutions that we've seen? Can we just clone the good leaders and send them to other states? How do we build more demand? What does it take to establish good data sharing policies? Do we use the university systems more? Should we start small and build up? Should we start big and build down? It's a really long list of potential solutions that in some cases will work in states, and in other cases, we need to think about the context of those states. But really, what are our best bets for moving forward? And ultimately, what does it mean to use evidence in the context of state decision-making? So, as you can see, we have a lot to talk about. And during our short event today, we're going to try to drill into many of these questions, but recognizing that this is a really important conversation that's going to extend well beyond today. Before we get to the discussion, I want to take a moment to thank the Pew Charitable Trusts, who are a co-sponsor and partner in this event. Pew has done a lot of great work in recent years, and you'll soon hear a little bit about some of that. They've sought to identify answers to some of these really challenging questions and promising practices for moving forward. The staff at Pew, through the Results First initiative and the Data as a Strategic Asset initiative, have really led this work. And then finally, I'd just like to take a moment to thank my colleague, Sandy Davis, for his encouragement in thinking more about the really important role that states play in building a culture of evidence across the country. This is actually Sandy's last week here at the Bipartisan Policy Center, and I can honestly say we've benefited tremendously from his leadership, his expertise, and his guidance, not just in developing this event, but in developing our entire evidence initiative and project here at the Bipartisan Policy Center. So thank you, Sandy, for all that you've done to help shape our field and our work here. So without further ado, I'd like to invite Sarah Dubé to the stage, and we're going to have a fireside chat about some of the work that Pew has engaged in recent years.
This is truly a fireside chat because Amber is stuck in Atlanta, unfortunately.
Yeah, so for those of you that tracked the program carefully, you'll know that one of our panelists was unfortunately not able to make it back to DC today. We're going to talk a little bit about her work, but if you'd like to learn more in great detail, I encourage you to grab the report that's outside on the table, and you can really learn a lot about some of that. So Sarah Dubé is the director of the Results First initiative, which is a partnership at Pew with the MacArthur Foundation. And in that capacity, she manages the work that focuses on states and some other levels of government as well to really help improve efficient investments in achieving the best outcomes possible. So Sarah, as I alluded to, you've done a lot of great work with you and your team and the other folks at Pew in recent years. Really just want to give you an opportunity to give us some highlights and tell us about some of the interesting things that you've done and the conclusions that you've been able to derive from those.
Sure. Well, thanks again for having me, and thanks so much to everyone at BPC for this great event. So as Nick mentioned, the Results First initiative is a joint project of the Pew Charitable Trust and the MacArthur Foundation. We've been around for about 8 years now, which is hard to believe. But when we were first funded in 2010, we had a pretty simple yet ambitious mission, which is to help increase use of evidence in state decision-making, which has increased now to county decision-making as well. And we do that in a few ways. First, we conduct research on evidence-based policymaking best practices to really understand what is going on out in the field, and then try to distribute that information and promote it as much as possible to really continue to build that field of evidence-based policymaking. We also develop tools, very practical tools for state decision makers and their staff to access and understand information, which is certainly a challenge that I know we'll talk about later. And then the technical assistants actually implement those tools. And then lastly, very importantly, we work very closely with decision makers to ensure that all of that great information is actually used in the decision-making process. And I'll talk about our research in just a minute. I think we've got a slide about data as a strategic asset. So this is not my project. I will give a couple sentences on this work. So Amber Ivy, who is unfortunately stuck in Atlanta, has done some fantastic work. The project at Pew, or the research project this was under, was data as a strategic asset, which is looking at some really fascinating data across the country that's really looking at states' use of big data. Obviously, this is a huge topic right now, a lot of buzz around it. So looking at the use of administrative data in state decisions. It's a fantastic report. I encourage you to check it out. But that is all I will say about that. But moving into our research, one of the three legs of the results for stool that I mentioned is conducting research. And one of our largest research products recently was a 50-state report we did back in January of 2017, which is looking at how all states across the country and DC engage in evidence-based policymaking. And obviously, we had a decent sense of how states engage in this. We've been at this for 8 years, but we hadn't looked at it in a very comprehensive way as we had in the report. So, and I say we, our research team. Our research team spent about 2 years on this project and did a tremendous amount of research. And the first thing they did, which is, I'm so glad you mentioned this earlier in your remarks, is looked at what is evidence-based policymaking. You know, this is a buzz phrase that a lot of people talk about, but have a lot of differing opinions on what it means. So we defined it for our audience so that everyone had a common understanding. And the good news is it's very much in line with everything you said, Nick, so no conflicts there. But we really drilled in to say it's the systematic use of findings from program evaluations and other rigorous research, otherwise known as evidence, to inform decision making. So really drilling into what is the evidence piece and how is that used. So once we had that kind of definition in place to understand what, to have our audience understand what we were talking about, we set out to do this pretty ambitious research. So we did a few key things. First, we identified 6 actions. Here we go, right here, of how states incorporate research findings into their decisions. And as you can see on the screen here, there are define levels of evidence, inventory existing programs, compare program costs and benefits, report outcomes in the budget, target funds to evidence-based programs, and require action through state law. And then I think something that's also interesting about what our research team did was they looked at both the prevalence of these actions, which I think we've seen discussed quite a bit out in the field, but also the sophistication of those actions. They really looked at both the breadth and the depth of how states are engaging across these areas. We also, next slide. Focused on 4 social policy areas: behavioral health, child welfare, criminal justice, and juvenile justice. And there's a few reasons for that. The main 2 are that there's a really rigorous body of research across these 4 areas. So there's a lot for states to draw from. So we knew that those would be areas that would provide states with a lot of ammunition, if you will, to be able to use evidence in their decisions. Also, these policy areas have really discrete outcomes. So, we're in criminal justice, we're looking at reductions in recidivism. In child welfare, we're looking at decreased incidence of child abuse and neglect. So we knew that there was a robust body of research out there, and also that there were discrete outcomes that research looked at. I should also mention, this is 4 policy areas. So this is not comprehensive. This is not looking at every policy area that every state could possibly engage in. This is certainly a limited scope, and even with limited scope, this took quite a while to do. So we were certainly focused in our look. And then finally, we categorized each state based on their the actions that they took, both, again, the prevalence and the sophistication of those actions across the 4 policy areas that they took between our study period dates, which was 2010 to 2015. So again, a relatively narrow, not for all time, slice to look at how states engaged in these areas and categorize them into 4 groups: leading, established, modest, and trailing. And if I think we have a map slide. There we go. So a lot of blue. Pew likes blue. A lot of variations of blue here. And we found that the good news is we found that most states have taken some actions. And that's, again, I think a point that we'll come back to. So showing that there's, across the country, there are modest levels of engagement in evidence-based policymaking, which is great news. We weren't really sure we were going to find with this report, but it's great. It's very encouraging to know that all states are doing something. But only 5 states are leading, meaning that they are engaged in this work in a very sophisticated way, which is probably not a surprise to most folks here. Those 5 states are Washington, Utah, Minnesota, Connecticut, and Oregon. And those folks are really leading in this field by developing processes and tools that use evidence in a very comprehensive and routine way, which, again, we can talk about in a few minutes. In addition to those 5, as you can see on the map, 11 states showed established levels of evidence-based policymaking. 27 states in D.C., which of course is the majority here, slight majority, show modest engagement in this work, and then only 7 states are trailing. So again, pretty encouraging. And that does not mean that those states are failing. It just means that they are doing less than everybody else. And again, we can talk about that in a little bit. So there's obviously more to be done. This is all great news, but there's more to be done. So to try to develop some lessons learned and kind of build on the success of the really leading states, we did identify a few themes of what a successful effort looks like. And then I'll stop talking. So a few themes here. Successful evidence-based policymaking efforts engage relevant stakeholders. So that, of course, means government decision makers and their senior level staff very early and often in the process. You have to have a champion for this work. Again, I know that sounds like common sense, but without a champion, this work can end very quickly. So knowing that there's a champion there. The second point is having champions both within and inside government. So obviously, as I mentioned, government leaders are incredibly important to have as champions, but it's also really important to involve key decision makers and key stakeholders outside of government. We found that involving the provider community, for example, is incredibly important. There's a lot of work that can be done at the decision-making level, but you have to have those providers on board in order to implement things effectively. Successful efforts also build staff capacity for conducting analyses and interpreting results. Again, a little bit of common sense, but you can't have successful efforts unless you have the staff to carry these things out. And then lastly, they create these states, successful efforts create mechanisms for ongoing use. So meaning enacting laws, establishing budget instruction, passing agency guidelines, things like that, so that this becomes the way of business, the way of doing business. That using evidence is, again, a routine practice that will hopefully survive transitions. We know we have a lot of those coming up, and will hopefully stand the test of time. So that is a quick snapshot of the recent research that we've done, and I think hits on a lot of the themes that we at Results First have worked on.
Great. So I'm curious if there's anything that I learned working in the federal government, and it's that states sometimes don't like to be ranked or rated. And I'm curious what the reaction was when you released the report from those out working in states. Was it generally positive and insightful, or?
It was generally positive because, again, we did not say that anyone was failing, and we also were pretty clear that everyone was doing something. So generally positive. Of course, we had some people who were questioning a little bit the categories they were placed in. I will say I think it was helpful that we didn't actually produce a 1 to 51, including DC, rank. So it was just these buckets of categories. So I think that helped. I think also part of the explanation that this was a very set time period. This is 2010 to 2015. We know that this is a growing movement, and there's a lot of work that's been done since 2015, which is fantastic. So we certainly acknowledge that. And I think also knowing that that there's been a lot of efforts taken in the past few years, but we recognize that as well. So I'd say generally it was positive because, again, it showed that everyone was doing something.
So you alluded to this in your remarks. Could you give us a sense of what you perceive or learned from the research that were maybe the one or two biggest challenges just across the board that states faced in engaging in this work?
Sure. Access to information, absolutely. We found across the board, and we found this both in the research and we've seen it in our work out across the country, that by and large, decision makers at all levels of government and their senior staff want to make the best use of limited resources. They want to be good fiscal stewards of taxpayer dollars, and they want to try to influence the best outcomes for their residents, but they simply don't have access to the information that helps them do that. And even if they do have that information available somewhere, they don't know how to get to it, and they don't know how to interpret it. So I think that's definitely a big piece. Being able to provide some of those tools, as I mentioned, to help policymakers and their staff access that information and understand it a little bit more. That's something we've done. We have a clearinghouse database, which is a clearinghouse of all national clearinghouses, not all, but 9 national clearinghouses that enable again, decision makers and their staff to get at program effectiveness information in a much more user-friendly way than they have in the past. And I think it also brings up the challenge of staff capacity. Again, decision makers have trouble accessing this information, and having the staff that can help them do that is critically important.
So we know there are 50 states, and there's a lot of heterogeneity in how they approach this. And I think your report highlights, by having a sort of rating system, that there are some states that are much further ahead than others. Yeah. If you were to just think about the states that lag behind, maybe without calling them out explicitly, what is it that we could do to encourage those states in particular to really boost their capacity to engage in this work?
Yeah. So again, there certainly were states that had done less in this area and are continuing to do a little bit less in this area. That's for a variety of reasons. Again, every state is different, as you mentioned. I think one of the themes that we saw is that states that lag behind really don't have the staff capacity to do this work. There is interest, again, I won't call it any states by name, but there is interest really across the country in doing this work, but there's often not the staff to take action. We've gotten a lot of requests from states wanting help in this effort, but a lot of what Results First does is help states do this on their own. And without the staff to train and to take on some of these efforts, and for this effort to live on without us, there's really no path forward. So staff capacity is critically important. I think that's one of the reasons why many of the states in our study and that we've seen across the country do lag behind when they don't have that staff capacity in place to take on this work.
So staff resources are really important. You have to have people in place to actually engage.
Yeah.
So we have a few minutes for questions from the audience, and there's a lot of folks here, so I want to just open the floor up and see what questions there are that would be useful for your own work. And if there aren't any, I'll just ask more questions. Go ahead. Yeah, and if you could use the microphone.
This is Brett Brown from Administration for Children and Families. I was wondering, that map was very interesting to me, and we work a lot. I work for OPRE, and so we're involved a lot with evaluations. And what do you think is the relationship between sort of states' rankings or capacities and the ability to support effective evaluations of programs? Are the ones who are the most advanced in a better position to be able to support effective evaluation work?
I certainly think there's a correlation. Washington State, and we'll hear a bit more about their work in a moment, but Washington State is one of the only states out there that has capacity to conduct evaluations internally. They actually have units within different agencies to conduct evaluation, and that I think is certainly one of the many reasons why they are leading in this field. There are ways, there are proxies to access national evaluations. That's part of what what Results First does in terms of our technical assistance. We help match states up with national research when they don't have local evaluations available. So it's not impossible to do this work without local evaluations, but it certainly helps. And I would say that there's probably a correlation between states that have capacity to do the evaluations internally or even contract out for evaluations and ones who are really succeeding in evidence-based policymaking.
I guess, I mean, so one of my observations has been that the evaluation function is largely not present in mass across a lot of states.
Right.
From your work, what's your sense of how developed the actual evaluation activities are across these states? Is it really as missing as I'm suggesting in most states?
Yeah, unfortunately, yes. So our research team actually put out a follow-up brief to this work on targeted evaluation and found that that really no states are doing this in a comprehensive way in terms of conducting their own evaluations. Very few examples, including Washington State, actually have the staff and the resources and the skill necessary to do the evaluations on their own. It's definitely, there's a dearth of in-state evaluations available. So building that supply of evaluation and of evidence is critically important, I think, moving forward.
Well, as I like to say, it's hard to use evidence when it doesn't exist.
Right.
So there you go.
Right.
All right, other questions? Go ahead.
Hi, my name's Carlene Ponder. I'm an attorney and an advocate, and I'm particularly interested in using data and evidence in policing. I know that the city of Chicago has been using something called the HEAT system. There are some questions about whether or not that use of evidence has been effective in lowering crime in Chicago. And I know that the public has questions about who controls that evidence and who's allowed to see it. So on that side, the effectiveness of evidence in policing, but also I'm wondering if we could use this where police reform is needed as well.
Well, I can certainly speak to the point about kind of the privacy issues that come with data and the suspicion behind the use of data and evidence. That's certainly something that we've seen in our work. Obviously, data and evidence are very loaded. They're loaded terms that not everybody trusts. So I think one of the key aspects of the Results First work is that we work very closely with state and county governments to train them on how to analyze their own data and to use evidence, whether it be national evidence or in-state evaluations, to inform their work. So much of the data stays with the state, all of the data stays with the state, and we are there to help train them. So privacy issues are definitely a concern, and we do our best to make sure that all of that data and evidence stay within the state. So absolutely, there's a lot of concern about the validity of data and some skepticism certainly about that. I can't speak to the policing piece, but I will say too that we have certainly seen a lot of work across the country and mainly in the policy areas that I mentioned here in the study, where folks have used data and evidence initially to look at programmatic effectiveness, which is really the focus of our work, to understand which programs are providing the best return on investment, which are the best bang for the buck, but then have taken that as a next step to really inform policy change as well. So I think that there's certainly a link between using data and evidence to inform programmatic decisions and then also policy and address policy questions as well.
Very good. Did we answer your question? Excellent. Well, just in our last couple of minutes here, maybe you can give us some insights from the research that Pew has done. I mean, what are the sort of one or two biggest actions that we would encourage states to take that would really make a big difference?
Yeah, I think there are two actions that I would recommend that are at kind of different levels of engagement. The first would be creating mechanisms for ongoing use. That's one of the kind of examples or characteristics that we saw of successful evidence-based policymaking efforts out in the states, and it's something that we've seen time and again out in the field as being very successful. So obviously there's a lot of interest in this work, but making sure that data and evidence are actually drawn on very routinely in the policymaking process is much easier said than done. So being able to enact legislation, to establish budget instruction that mandates the use of evidence-based programs, that prioritizes the use of evidence-based programs, that even requires the use of things like program inventories to get a clear sense of what programs are currently being offered, just to do that baseline assessment. So we've seen that be very successful. I know Colorado has done some of that work, and we'll hopefully touch on it in a few minutes. So really creating those mechanisms for lasting change so that, that there is that routine use that they can draw upon. And then in terms of what kind of everybody out in the field can be doing. I mean, obviously not everyone can pass legislation or change budget instruction in their daily job, but we talk a lot about kind of building the culture of evidence-based policymaking, and that's another buzz phrase that that is certainly loaded as well. But I think one of the ways that we've talked about changing that culture, or building the culture of evidence, is that everybody who's involved in this work, no matter what your job is, whether you're in the agency, whether you're a legislative staffer, is just to be the one who's asking, is this working? You know, is what I'm doing working? Is what I'm doing advancing policy that my bosses are interested in? Is it the best use of finances? So I think a lot of that change can come from within agencies. And again, those ongoing mechanisms are great, but I think also building that culture one person at a time within agencies by being the person who asks, is this working? Is this the best path forward?
So everybody get to work and start asking questions. I think that's a perfect note to end on as we transition to the next panel. So Sarah, thank you so much for sharing your experience and your research with us.
Thank you.
So I'd like to invite my colleague Kira Fothery, who's a senior policy analyst here at the Bipartisan Policy Center, to introduce you to the next panel. And if the panelists would please come to the stage.
Thank you. Swap them out. Thank you. Thank you, Nick. And thank you, Sarah, for sharing your research and findings with us. It's really wonderful to be here this morning with you all, joining in this room, as well as you joining via webcast. My name is Kira Fothery. I'm a senior policy analyst here at the Bipartisan Policy Center. To continue the conversation and hear from people who are on the ground really generating and using evidence to inform programs and policies, we're very fortunate to be joined by these three panelists. Beginning on my left, Jessica Corvinus is the Manager for Research and Evidence-Based Policy Initiatives for the Colorado Office of State Planning and Budgeting. Eric Trupin is a professor and the Director of the Division of Public Behavioral Health and Justice Policy at the University of Washington in Seattle. Eric was instrumental in developing legislation that requires services to be evidence-based in the state of Washington. And David Yoakum is the director of the lab at DC. David was previously a founding member of the White House's Social and Behavioral Sciences team and director of Scientific Delivery Unit at the U.S. General Services Administration. Thank you all for being here.
Pleasure.
To begin the conversation, I'd like to ask each of the speakers to offer some brief background. Jessica, please tell us about your office.
Sure.
And your role, and we'll pull up a slide for you.
Great. So as Carrie mentioned, my name is Jess Corvinus. I have a really long title. We're still working on how to shorten it, but I am the Research and Evidence-Based Policy Initiative Manager for the state of Colorado in our Governor's Office of State Planning and Budgeting. And I, right? And I already have a long name, so the long title just adds to it. But we do have a slide with our timeline. So I can't see it totally well, so hopefully I get all of the dates right. But as you can see, Colorado has a long history of data-driven initiatives and evidence-based policymaking. So starting in 2011, Colorado implemented our LEAN initiative, if people are familiar with that, really building on how do we create more efficient, effective government. And then building off of the success of LEAN and the LEAN initiatives, we actually were able to pass legislation in 2013, the SMART Act, which is the State Measurement for Accountable, Responsive, Transparent Government, which really really formalized our performance management tool and that process into legislation. So every year, state agencies are actually required to submit a performance plan with their vision. That really established that in our state government. And then I'm going to take a moment and really talk about 2014, which is really our foray into the evidence-based policymaking space. So a couple of things were happening in 2014, but I will say most importantly, the Results First initiative came to the state of Colorado. So that's actually when I came to the state and started working in the governor's office. Results First initiative was actually jointly funded by the legislature and the governor's office. So myself and my colleague were actually hired on to implement and populate the Results First model, and we were mandated to look at 3 policy areas, so adult criminal justice, juvenile justice, and child welfare. So again, I used to be the Results First project manager. That used to be a really nice short title, but we have since expanded our work to this broader research and evidence-based policy initiatives, and I'll talk a little bit more about that. But we've since expanded our Results First model, and we've essentially completed every policy area, run benefit cost analyses, done program assessments through the Results First model. So we've published 5 different reports, and that's really kind of what got us into the evidence-based policy space. Although we were able to do those program assessments and run our benefit cost analysis, really what we recognized during that process is that a lot of programs fell outside of what we considered evidence-based by our standard, and we wanted to understand, well, what else can we be doing? I know we've talked a little bit more about evaluation. That's really important in our state, so we really recognized that we needed evaluation supports and implementation supports, and that's why we've since expanded our work to become the Research and Evidence-Based Policy Initiatives team versus just focusing on the Results First model. So that was in 2014. That was a big year for us. A couple of other things that I wanted to highlight on this timeline that we're really involved with as the Research and Evidence-Based Policy team is we also brought Pay for Success into our state in 2016. So we've worked hand in hand with our Pay for Success project manager, who also sits in the Governor's Office of State Planning and Budgeting, and have really focused in looking at when the proposals came in, we put out what we call a call for innovation, which is a little bit different than a request for proposals or a request for information. We really wanted to hear from the communities what they thought would impact different youth outcomes. We're focused on crossover youth. So those that are served by multiple systems. And so we helped look through those proposals, assess the level of evidence for the different programs that came through, and then we're evaluating all 3 of those proposals that were selected through rigorous evaluation. So we helped with that evaluation design, kind of thinking through that. And then in 2017, we established the Colorado Evaluation and Action Lab, which is one of these policy labs that was mentioned earlier, which is really focused again on bridging that gap between the academic community and state government. And instead of it kind of being the academic community saying, hey, we have this really great idea on what we want to study, it's actually working in partnership with state government and state government agencies saying, hey, we have this problem we want to fix, we want to know more about this, how do we work with you to get rigorous evaluation done? And so our team is also really heavily involved with the Evaluation and Action Lab. They actually have oversight of the governor's office. So we created the priority areas, but it's them working in voluntary partnership with the state agencies to really determine what projects are going to be moving forward. So that's kind of the landscape and the background of where we are. So I've been in the governor's office for 4 years now, and it's been a really exciting journey. We're excited to see what happens at the end of 2018 and going into 2019. So.
Great, thank you. And Eric, could you tell us about your work in the state of Washington?
I'm actually standing in for, excuse me, a legislator named Mary Lou Dickerson, who was instrumental in initiating and engaging our state and our legislature in interest in evidence-based practice. We're really fortunate that there's been a long history in interest in outcomes, and it's primarily, or the primary interest was driven some 20 years ago when our state was on the verge of initiating a major expansion in corrections and juvenile justice. Build more beds was the idea. We're having this incredible increase in youth crime and adult crime, and the expectation was that we ought to invest in strategies that would have an impact on that. Somewhat at the same time, progressive legislators were interested in establishing an entity that would actually look at the outcomes of policy, and established an organization called the Washington Institute of Public Policy. So one of their initial studies, one of their initial projects, was to do a meta-analysis of outcomes for youth as well as adults as a function of what the intervention was. Were they placed in a secure placement? Were they provided with some type of intervention? And the meta-analysis was very, very profound and persuasive to legislators that it wasn't really a good idea to invest in new prison beds and juvenile justice settings, but there are all these alternatives, all these different community-based programs that showed not only good outcomes as it relates to recidivism, but being that this institute had a number of economists involved, they had fabulous economic effect sizes. So this sort of built an appetite on the part of legislators for, let's look at evidence before we make some decisions about where we're going in terms of policy. I was very, very fortunate to be working with legislators who in fact had an interest in what are the outcomes for kids, particularly kids and adolescents in behavioral health, mental health, and substance abuse, juvenile justice, and child welfare. This was really driven from, we don't have good outcomes. We have 60–70% recidivism rates, particularly for black and brown kids in the juvenile justice system. We have what is perceived as poor outcomes for children and youth and families who are involved in behavioral health. And in child welfare, permanency planning in terms of outcomes of children returning homes really was not where it ought to be. So there was an interest in could we do something else? Are there programs, are there interventions that might in fact improve outcome? So this really was in Washington State, legislatively driven, and we're really fortunate, well, I'm fortunate, being that we're the only university that does extensive healthcare training in Wyoming, Washington, Alaska, Montana, and Idaho. So there's been a long history of a relationship between policymakers and university types. And this is prior to thinking about things like implementation science. There's a lot of crossover. People are legislators and legislative staff are talking to us about what we might do to impact improved outcomes for kids and families. So if I have probably the second slide, we had a piece of legislation, again, bipartisan legislation. So the interest here was not on one side or the other. There was a tremendous amount of interest on the part of our legislators around outcomes. And some legislators were much more interested in economic effects. Are we throwing money away? Are we misusing taxpayers' money? And other legislators were much more interested in what is the social impact of implementing evidence-based programs. And I'm thinking about Sarah's slide on the four attributes that contribute to effective evidence-based practice. We had a very dynamic and enthusiastic group of legislators who were interested in this. We had providers and families and youth and individuals who had been impacted by interventions that were effective. So there was a constituency that existed that could go and support legislation. And the original legislation laid out some guidelines, which also established within our university an evidence-based practice institute. The expectation was to work in collaboration with government, in collaboration with providers on implementing, expanding the use of evidence-based practice, expanding the workforce that would be able to implement those evidence-based practices, as well as evaluating the effectiveness of those practices. You go to the next slide. Legislators felt over the course of the time between that original bill, House Bill 1088, and the subsequent years, the process was moving very slow. There was not a lot of data coming from state government, from the executive branch, from the various divisions that were responsible, being able to demonstrate that there actually were implementing evidence-based practices. So a bill was put together, which is a very, looking at other pieces of legislation, very authoritative in nature. It required us to develop definitions for evidence-based practice, create an inventory of evidence-based practice that the provider community could use, and then to hold the provider community responsible for, over the course of years, implementing these evidence-based practices. The inventory, you could go to the next slide. I don't think you could see it, but the inventory exists on the Washington Institute of Public Policy, as well as our Evidence-Based Practice Institute website. Defines evidence in evidence-based practices, research-based practices, and promising practices in very specific ways. And the way we defined evidence-based practices, not only on the basis of clinical effect sizes, but also economic effect sizes. Did they actually save money for government in terms of implementation? We based this inventory not just on what the research, obviously on what the research showed, but we obligated ourselves to look at the sample size of the research and to make sure that it aligned with the populations of Washington State. Washington State has approximately a 30% minority population. So in order for a program to be deemed evidence-based, it required that it had a sample size that represented what Washington State had. Much of this, as this legislation was being developed, the provider community was particularly concerned about resource allocation, about if you are going to hold us responsible for implementing evidence-based practice, there needs to be some reallocation of the structure of how providers are paid. So much of our work has been done with individual providers around how they could orchestrate their budgets so they in fact could buy, purchase, implement evidence-based practice. In addition, we were interested in also engaging in a discussion about promising practices. So we have three categories: evidence-based, research-based, and promising practice. And it was really very important to engage the provider community in what do they, from the wisdom of the provider community, what do they think they can do to make this occur, or what are they doing that they think could move up the evidentiary chain, and work closely with them to affect that. Sustaining interest in evidence-based practices is not only an ongoing issue. It requires a great deal of attention, lots of feedback about data, creating enthusiasm, maintaining knowledge base on the part of legislators and other stakeholders around the impact of evidence, as well as developing data systems, which we're working on, to be able to demonstrate that these evidence-based practices are having an impact on the areas on behavioral health, child welfare, and juvenile justice.
Great, thank you. And David, could you talk to us about the lab at DC in your role, please?
I had a feeling you might ask that next. Well, it's a pleasure to be here with y'all. I'm David Yoakum, the director of the lab at DC, which is in the executive office of Mayor Muriel Bowser here in the district. I think for purposes of our discussion today, it might be a somewhat unique example of some structural and even approach types of changes we've been trying to make kind of in the bureaucratic weeds to put some more meet around this bone of an idea of evidence-based policymaking. And so from a structural standpoint, we actually have a team of about 15 to 20 scientists who are district employees based out of the Office of the City Administrator. So think individuals with graduate level backgrounds and experiential backgrounds from fields like mathematics, sociology, anthropology, cognitive psychology in my case, coming from a mixture of academia, government, nonprofit, industry, somebody from the military, and coming from different levels of their career, everything from someone finishing up graduate school to a dean of a medical school. And so a pretty diverse mixture of perspectives, connections to communities of practice, even just approaches that they take. And this is by design to give us a little bit of flexibility to meet the really diverse amount of problems that government, of course, has to deal with. The other structural thing is that kind of hub of individuals I was just describing spokes out, if you will, to scientists across district government, of which here in the district, but this is true of most governments across the country, there's an amazing quantity of talented people, often with scientific chops you might not realize, but they're often disconnected. They're isolated. You know, you encounter data scientists who have a computer that can't run R or Python or something like that. And so we try to use the lab as sort of a platform for building this community of practice, knowing each other, sharing code, sharing ideas, and just facilitating the peer review and sort of participatory elements that are just key of doing good scientific work. And the other layer of spoking out is to universities and research centers in the community. And so we have a center of gravity inside of government that I think becomes a unique connection point for people that are at universities and think tanks and research centers that have wanted to try to help government do this type of work but haven't had necessarily the same amount of capacity in-house to sort of resonate with. We're trying to kind of fill that void. And so with this kind of structure I was just describing, the types of activities that we do are, on the one hand, of course, projects, actually trying to solve problems, right? So we've done things like the world's largest randomized field experiment to try to understand what impact body-worn cameras are having on interactions in the street between officers and residents, also how that video footage might affect downstream outcomes in the courts. We've got other randomized field experiments in the place trying to do things like implement a nurse triage line that might reduce on improper ambulance sends, playing around with how we might better design housing subsidies. We have kind of a different category of projects where we're taking the vast amounts of administrative data that the district has and trying to stitch it together, and then doing things like building predictive models to identify where rats are most likely in the district so we can target those little buggers, or identifying where housing violations, health and safety violations might be happening in physical infrastructure. It's kind of a whole category of things where government has scarce resources they need to prioritize, we might be able to build models to help do that. We have things like a Formapalooza initiative, which is a high-level idea to draw on psychological science, user-centered design, to systematically redesign every government form, which is like the most common touch point we have with government. And if you've not noticed, we don't always design the most intuitive government forms. And so imagine a world where every form that you touch, whether it's paper or digital, is simple and easy to use in the same way that when you pull out your phone, you can just use it. How nice of a first impression that would be for government. So there's lots of projects like that and more in between. I'd invite you to go to the lab.dc.gov, where we actually have another link to descriptions of all the projects that we're working on, and depending on where it is in the stage of the project, pre-analysis plans that articulate what we're trying to do, and then ultimately, of course, the results of what we learn, because we're going to try to be absolutely transparent about every single project that we work on. So that's the projects, that's the left hand. The right hand is a lot of thinking and investment in how to actually change the bureaucracy to facilitate doing more and more of those projects, right? And so this is one where issues of what kinds of changes we might need to make in hiring, say, right? And so for those of you who worked in government, even just little things like going out of our way to have position descriptions that really tightly describe what we're actually doing, as opposed to just picking one conveniently off the shelf that's like close enough. I think my first job in government, I was like an IT specialist at the federal level. Not what I was doing at all. But those are the kinds of little bureaucratic things that set the stage for what you're trying to do. Procurement is another issue. How can we make changes in procurement so that if we're hiring a vendor to go out and do data collections, can we make it required that they give the data back to the state? Can we make it required that they give us the code back? It's crazy that we're paying for this stuff and then we're not getting it back. Budget is another big issue here. How can we actually sync the timing, the rhythm, the sort of information in a way that fits the bureaucratic realities of how quickly a lot of these decisions get made? And this is something that I think is both high-level structural things that are going to come from legislatures, but this is also a lot of bureaucratic weeds of looking at budget analysts and what their pace is like, and can we get these things in the right digestible format at the right times. There's more on building that community of practice that I was referring to. And so here at the lab at DC, we do things like the lunch at DC, a bi-weekly kind of speaker series where we put a lot of thought in bringing in researchers who have sort of innovative or basic ideas even, but try to facilitate the discussion in a way that's very tailored to what we're trying to do here in the district. Even just like little things, like if we're going to talk about education, let's go physically to the education agency so it's really easy for people to slip in. There are another thing we do called the podcast at DC, which is a podcast, another venue to sort of talk about the research. We try to bring it really down to home with concrete examples about how it might play out in a city. And so a lot of the examples are here in the district, of course, because that's where I'm at, but I think it's of relevance to anyone across the country because so many problems are kind of commonly shared. And my hope with that and the lunch is that talking about the ideas and then really getting in the weeds on how it might work specifically help make real some of the abstract concepts. One of the podcasts, by the way, is specifically on big data policing. It went out. And we talked for about an hour about what the state of the science is, some of the things that we know about what's working, what's not, privacy implications. There's another second part that's about to come out in a little bit where we actually have a similar conversation with the Metropolitan Police Department about what's happening here. And this is all meant to sort of stimulate a larger community discussion about how do we get these really complicated issues right. And I think it actually continues the trajectory of what we did on the body-worn camera study of not only trying to get the science right, but getting the, I'll say politics right, but in the sense of these are often really big value judgments that are embedded in this. You know, what kind of privacy things do we want to weigh or not? It's not a scientific judgment. That's a political judgment. And so we need to do the science in a way where you have these value judgments to plug in. We build processes to do that. And so anyway, there's a lot of projects. There's a lot of capacity building. Maybe the last thing I would say is I'll again invite you to lab.dc.gov and to be a part of this. So we're in the district. I bet a lot of you live here. This is really meant to be a platform. We're going to be putting out calls for if you might want to work with us, like literally we're about to start hiring. But we also bring in people to work on ad hoc projects. And so if you go to the website, you can sign up for the listserv and do that. Last thing I'll say is this all came online after 2015, so after the report. I'm just saying, once you do the next one, you might need a color other than blue to sort of designate what we're doing here.
Thanks, David. Nice, good pitch there. So you've really built the lab at DC from the ground up. You alluded to some of the challenges, but could you talk about some of the key challenges you faced with accessing data?
So there's a lot. And it depends on the agency that you're at. I think it's rightly been alluded to that the technical components are variable, by which I just mean how good the system is from an IT standpoint is variable. And this is a space where we know how to build integrated data systems from a security standpoint, from an IT standpoint, but the history in any particular agency might get slowed down on doing that because they don't have the money. Or maybe they have the money, but they're locked in to a series of contracts that are difficult to kind of unlock at the right timing so that you can actually procure or build something that's proper. But there's a whole other category of one that I think a lot about. I actually gave a whole talk on it. I think it's like online now, of just kind of the psychological challenges of sharing and using data. And it includes, I won't try to go through all of them, but it includes things like, for instance, sometimes when agencies are nervous about sharing data, it can be easy if you're on the outside and haven't dealt with administrative data inside of government to think, why aren't you willing to share? Are you censoring something? What are you afraid of? Just give us the data. And I think what often gets missed here is internally, administrative data has typically a tremendous quantity of quirks, just weird things. Like it wasn't data sets that were built for research purposes. And we often live in a world where the administrative data isn't documented in a way to facilitate research. And so people have legitimate concerns that if they just pass the data set out, it'll be misused. Researchers will work with it and literally make wrong conclusions because they don't understand the process that was generating the administrative data set. And so the right way to do this, of course, over time is to try to fix the quality of the data, do a lot of documentation so that you can explain to researchers what to do. But both of those things, you can see how that's no longer a quick, oh yeah, I'll email you the data back. It's, I need now, as a bureaucrat, enough time to invest in building all of this documentation and process. Until I'm able to do that, I can't responsibly share the data with you.
Right. And Jessica, you spend your energy synthesizing information for decision makers.
Yes.
Could you talk to us some of the challenges you face in translating that information for decisions?
We have so many challenges on so many different levels. I don't want you to be fooled by thinking this is like such easy work, let's just all dig in, but it's all worth it in the end, I promise. But as far as challenges are concerned, sometimes that's just a product of where I sit. Like I said, I'm part of the governor's office, state planning and budgeting. So sometimes that's just, how do we define evidence? We're synthesizing this information to present programmatic information on what do we know that's effective and evidence-based in our state. Our office has a definition for what that means, but that does not always translate to agencies and what state departments identify as evidence. We know that there's levels of evidence, right? Like there's good evidence, there's maybe some bad evidence. Evidence to us typically means rigorous clinical trials. Evidence to a department might mean Johnny's cousin's brother's sister went through a program and it worked, so of course we're going to do more of that. So it's just kind of speaking a common language and having a standard. In Colorado, we haven't necessarily been able to do that. We've tried a couple of times to pass legislation around what does evidence-based mean. Actually, one of our legislative staffers went through statute and found 86 references to the term evidence-based, and nowhere is it defined. So we live in this place where it literally means everything and it means nothing at the same time. So when we're out there in the budget world and saying, we have new budget instructions, we want you as a department to submit your request, and we want you to say, this is the evidence that supports our program, we want you to create a plan for evaluation and implementation, we're kind of asking them to define it for us, and then we're assessing it, which creates a little bit more work for us, which we're happy to do. But at the same time, if we had that consistent definition, if we had that standard, we could talk to agencies a little bit easier, we could talk to legislators a little bit more easier. It would be kind of a level playing field that everybody would be starting from. But as we talked about with data and privacy and some of these different things, there's a lot of fear built into this work. People don't want to kind of expose their program, open their program. What if it's not working? What if it's not working how well we wanted it to? We try to talk about, well, what is it evidence-based for? Are you looking at specific outcomes? We want to make sure that we're not creating harm like we talked about, but there is a lot of fear in this, people exposing their information. If it's not evidence-based, is it going to be cut? Is it going to go away? So it's a lot of kind of having these conversations, assuaging these fears, getting on the same page with folks. I think a big part of how we've addressed that challenge has been around the outcomes. We have a lot of conversations around, what evidence-based means to our office and what evidence means to another office, but do we actually have evidence to support that the outcome that you're interested in is actually being supported? And so talking about it in terms of outcomes has been pretty helpful for us, but it still remains a challenge as far as that standard and that consistent definition is concerned. But we're still up to the challenge. We're tackling it every day. So
Great, thank you. And Eric, we often talk about evidence-based policymaking at a really high level, but less frequently kind of really getting into the details and understanding the processes and inputs of evidence. Could you talk about some of the legislation you've worked on, maybe one example, and what the impact's been and how it's been beneficial?
Yeah, I want to comment on, before I get to that, convincing legislators and legislative staff that there is evidence that has a positive impact on outcomes for kids in juvenile justice, or a youth in an out-of-home placement, or a child with a serious mental illness, often is, and historically in my experience, is incredibly challenging because it flies in the face of what they see and what they hear about. So it's taking the time over the course of long periods to really show that there is effective ways of bringing about positive outcomes, and particularly using the people who have experienced those outcomes, has often as much credibility as any data that we've been able to. Yes, we have to have the credibility of the data, but actual personal stories about how this program has had an impact, has had a tremendous impact on legislators being able to overcome their biases around these issues. So as it relates to legislation, the legislation that requires our state to, in child welfare, juvenile justice, and behavioral health, to use the identified programs on this inventory, we've seen a significant increase in the implementation of evidence-based practice, and we can document it on the basis of we have developed a way of ascertaining whether they're actually doing these in adherent ways. Only some of these practices have built-in adherence and fidelity measures, but we've worked with the provider community in helping them to use tools that actually help them in terms of defining clinical outcomes and helping to guide them in making implementing these programs. So the data actually exists. We've been able to show year by year by year the increased use of evidence-based practices, decrease in emergency room placements for kids with serious, decrease in number of kids going into secure juvenile facilities as a function of getting specific programs. So we have we're access to data that actually demonstrates the effectiveness of this. It's built into the legislation as well. We had it built into the legislation that there needed to be ongoing evaluations and outcomes around this
Great
project.
Before we open it up for questions, David, can you tell us about one of the most pivotal or biggest successes you've had?
Well, that's a nice invitation. So from a structural standpoint, one of the biggest things that's happening right now is we're actually shifting to permanent funding. And the investment like this into something like the lab at DC and the structure and the people I was talking about is a very serious commitment from Mayor Bowser and from everyone else at the leadership at the council that they mean business here. And we start off with sort of generous funding from the Lauren John Island Foundation, thank you all, but this is something that we need to be investing in as citizens. It is very expensive not to spend money on research. And I think as a proof point and making that sort of the case for that is something that's hopefully going to start to replicate at jurisdictions across the country, so that we just invest more in this capacity sort of directly. The other thing I would say is that I view a lot of our approach or my thinking on this has shifted a little bit away from trying to convince decision makers, here's a piece of evidence that you need to pay attention to a little bit more of a conversational approach around what's a problem you're trying to solve that if we could provide answers to certain questions, you would spend money differently, you would staff differently, and then going back and tailoring research agendas to that. And maybe there's a paper that's out there that we can come back with, but it's one where we're sort of shifting the posture away from like convincing people and more about tell me what you want to do and we'll sort of empower you with information that's out there. And so places where I get excited on some of our project examples are ones where we have tailored field experiments to answer a question that was jointly identified in advance with the actual decision makers, and they've bought on to act at a function of it, and then we've done the study and then they've turned around and scaled it. Even if it's a small thing, like let's do a improvement on the paperwork that people on TANF use to stay enrolled in the program, which we did, and showed that a particular redesign kept many hundreds of families that were eligible in the program, and then turning it around and scaling that, now many hundreds more families that need this benefit are keeping on it, is a concrete momentum of a proof point of this approach that's now starting to be talked about across district government amongst employees and replicated, and that excites me a lot.
Great. And Jessica, could you briefly talk about an example where your office has used evidence to really make a meaningful difference?
Yeah. So during our first dive into the results first model, as I mentioned, we were mandated to look at adult criminal justice, juvenile justice, and child welfare. So since we were mandated, that meant that the department had to work with us. So you can imagine that maybe they were a little less excited. Like I said, there was a little bit of fear around this already, and now they're like, okay, now we're already scared about it, and you're forcing us to go into this project with you. So during that time period when we were going through our program assessment, we worked with our Office of Community Corrections. Community Corrections in Colorado is actually our halfway house system. So in working with the office, when we did our program inventory, we actually identified that every program that they did in the Office of Community Corrections was not only evidence-based, but it was effective and evidence-based, which is a home run, right? Like no other office, no other department had did this. They could say, look, we do all the evidence-based programs. But what we would have expected when we ran through the model that we would get all of these cost-beneficial programs as a result is that none of their programs, other than their standard residential treatment program, showed to be cost effective. So there was kind of this, well, we have all of these evidence-based and effective programs, why are we producing a negative return on investment? And so when we did a deeper dive, they really looked at their internal data and said, our escape rates are really high, our recidivism rates are really high, our program failure rates are really high, like something is not matching up here. And the other thing they noticed is that over time, their population had really changed from low risk. When you think about community corrections, you know, they're trying to serve these low, moderate risk populations. But over the past decade, they were serving 85% high risk folks. And so the programs that they were offering were not matching their population needs. So when Eric talked about, you know, are we really matching these programs correctly? They were not. So their specialized treatment programs weren't matching those population needs. And they said, you know, we need to go back to the drawing board. We really need to find a program that matches their needs for these high risk offenders. And we were able to get them funding for a pilot program. We went back to the research and said, hey, there's this great cognitive behavioral therapy program that seems to match with the population that you're trying to serve. We were able to utilize the model to run predictive benefit cost analyses and say, if we were to implement this based on our assumed startup costs, we're actually looking at a positive return on investment. We took that to the legislature and the pilot was funded. The great thing about this is that, as I mentioned through this process, everyone was terrified that all of their programs were going to be cut. And so we didn't cut any programming. We just diverted funding from the unused beds in the specialized treatment to fund the new pilot. So those programs are still available to the appropriate population, but from those unused beds, we're able to utilize that funding to support this new program. The pilot is just wrapping up, and we're hoping that we'll be able to scale based on the information from the pilot. So it really just highlights our right services for the right people at the right time and in the right way when we're thinking about implementation. And it really makes us recognize that, you know, we can be doing a better job, and we need to be looking at the types of programs and services we're delivering. So
Great, thank you. There's clearly a lot to discuss here.
Yeah.
Let's go ahead and open it up for questions. Are there any questions? We'll bring you a mic.
Hi, my name is Grace Levin. I work at the Department of State. And this question's for you, David. Thank you for explaining that a lot of your research is tailored to decision makers' needs. I imagine that there's some of that, and also you kind of discovering issues through data and evidence that sort of just happen naturally. What happens after you've identified a problem and potentially proposed a solution based on your data and evidence to a decision maker, but they maybe don't have the staff or resources to go and implement the solution? Or, you know, do you run into situations where you've, you know, got this great idea, this great program potentially proposed, but it doesn't go anywhere? I mean, what does that process look like? Where do those ideas go?
No, it's a great question. I mean, for me, it goes back to investing a lot more than we typically do on the initial problem scoping. Like, what is the thing we're actually trying to solve, and what does a solution look like that is both effective in a technical sense, but also implementable in a political and operational sense, and tailoring it around that. And so there's a couple of layers I could take. I mean, one is, if we know we're going to be constrained over the coming years to a certain set of staff and budget, maybe it moves a little bit, then we need to design something that's going to fit that. And so if we're talking about a reentry program or something like that, maybe the perfect intervention is going to cost $100 million, but if we only have $20 million, we need to figure out whether there's something in between that's closer to that. This happens all the time, by the way, when academics and stuff send papers like, just do that real quick. It's like, yeah, we can't. There's another layer, though, that is, for those things that seem really, really promising, having the sync. This is where the sync with longer-term planning and budget starts to come in, to where we are going to be learning things that we don't have the resources for now, but we need to do research in a way that is preparing to make the case with data, compelling stories, et cetera, to actually turn around and invest in things that are going to be more expensive. But that takes time, and I think the style or the nuance here is to not do the research and then start talking to the people that are going to be responsible for the scale. They need to be at the table on day one, and a key part of talking about what it is we're trying to do.
Great. Other questions? Right here. Mike's coming.
Hey, how's it going? I'm Matt Leonard with Government Computer News. I was hoping that you guys could talk a little bit about sort of the technology side of this. David, you mentioned it briefly. You said we know how to make these integrated data systems, but if you could just talk a little bit about how you guys have gone through that process at your states or in DC, that would be great, and any like challenges you might have faced when building up those systems in order to get it from that administrative data that can be kind of sloppy and not necessarily for research, and then into this data that can then be used to create evidence-based policy.
Thanks for the question.
Yep.
We're very fortunate to have a shared database within our social and health services, juvenile justice. So we can access information on outcomes for a youth, whether she or he is making use of Medicaid services, whether they're in and out of juvenile justice settings, whether they've been charged with some crime. So there's an integrated database that allows us to really ascertain outcomes in various domains. So that is a very, very fortunate circumstance. So when we think about outcomes and someone says, well, is this kid going to school? As a outcome of whatever the intervention, rather than whether they're feeling better about themselves, we have access to that kind of data. And it's, in fact, that kind of pragmatic, practical data is very, very much more convincing than some change on a scale or on some assessment.
Yeah, my point with that was that there are very good secure integrated data systems to be found in examples of things like state longitudinal data sets, but also just look at private industry and places like that. So from literally a technical standpoint, we know how to do this. I think where we get stuck in the mud are some of the things I was alluding to a moment ago about getting the right rhythm with how to figure out how to unlock the contracts, how to get the budgeting right, and so on. And maybe the one thing I would use this moment to say here is that I think we've tripped ourselves up, or at least I've seen it trip ourselves up when we're making this case by sometimes focusing too tightly on just investing in a data system for a data system's sake. Other than like scientists and data scientists, nobody like cares about data per se, right? What they care about is some problem. And so I've shifted a lot the way I talk about this and think about it we're trying to solve a problem. Oh, and by the way, while we're trying to solve that, one thing we're going to need is just a means. Like, we're going to have a little data. We need a little data system. So like while you're investing towards this problem, like I just got to build a data system real quick. And that is probably the right way to think about it, And we don't always do this. Like people ask for data all the time without having clarity on what they're going to do with it. So that's something that might give us more progress on the budget arguments, I think.
And in Colorado, in our office, we haven't tackled that particular challenge head on, but it is one that our Colorado Evaluation and Action Lab is trying to tackle because they're trying to do these rigorous research projects. They need access to a lot of different state data. So for example, one of the projects that they're looking at is focused on super high utilizers. So how do different systems define what high utilizer means to them, and then how do we more properly target things like housing vouchers to those that are in need, or coming out of the criminal justice system, whatever that looks like. So they're really focused on addressing that. I think the problem that we faced is around, again, fear, and it's all personally identifiable information, and how can we put that out there? And the default is to find all the answers as to why we can't share data, but we're trying to switch that conversation to the default is yes, but what are these sort of hiccups, or things we have to think about? And so they're really focused on data linking versus data sharing. That's kind of the language that we're using in terms of how do we share, or how do we link it, and not necessarily you're getting all of this personally identifiable information. So kind of thinking about it in a different way. But that's a lot of the work that the lab is taking on.
Great. We have time for one or two more questions if there are some. In the back, over there.
Hi, good morning. My name is John Cobb. I'm with Department of Homeland Security. I'm curious, how do you work with stakeholders outside of your state, or especially here in the district with all these Virginians and Marylanders and other people? Just curious what your how you work that.
Would be you.
Yeah, well, Virginians and Marylanders are lovely people. Everybody's welcome. So, yeah, I mean, a lot of the problems span geographic boundaries, and so we need to coordinate. I mean, I think we're at a stage right now where lots of our projects are staffed up as best as we can, and we bring in people from all kinds of places to collaborate on a project. We don't have like a super formalized yet way of doing this. We're kind of building towards that a little bit just for efficiency's sake. But in the meantime, if you look at a lot of the projects that we have on our website, lab.dc.gov, you can find people that are working on the project, and you'll notice that they're a mixture of central kind of lab staff, people at agencies, other academic or nonprofit partners that are on there, and that just emerges through kind of finding the right people at the right place. The other thing I would say is that for many of our projects, this is going back to what I was alluding to of doing a lot of kind of community engagement to scope out what the problem is and to start having discussions about how we might try to tackle it and setting expectations about what we'll learn and what we'll not. And so the body-worn camera study, for instance, that I mentioned, before we ever started to get into the data at all to look at what it was telling us, we wrote a very detailed pre-analysis plan, or kind of a description of the method that we were going to use in advance, and we publicly registered it. And this is good for research integrity purposes, so you don't get in there and, torture the data to say what you want. But from a political perspective, it also gives a lot of forum for talking about, are we answering the right questions? What are the things we're going to learn or not? And we did about 12 different community events with people from police unions, with the ACLU, and a lot of other groups, with college students, with high school students. And then on the back end, when we had the data, similarly we went out and talked about it. And I think this is a key part of the work to where ultimately, like in some sense, ultimately the people that really need to buy into this are all of us, right? Not just policymakers, but the really ultimate leverage over political people is political pressure at the voting booth that if you are doing something and you're not using data and you're not running field experiments, I'm going to consider you an irresponsible politician and vote you out of office. Like that is the ultimate win for this movement, to my mind. And we need to invest, I think, in a lot of this community discussion to get there.
Anything to add on stakeholder engagement? Go for one more question. Yeah, right here.
Hi, Christy Schlenker, USAID. So David, you've talked about this a lot, but I'm curious to hear everyone's take. How do you find the right balance between what sort of capacity you need in shop versus when you're contracting out or working with a think tank or local local or national sort of universities, either nearby or somewhere else?
As part of the legislation that was designed to implement evidence-based practice, there was a resource that came both to the Institute of Public Policy and to this Evidence-Based Practice Institute to carry out these kinds of activities. If you're asking how much, I'm not sure how much, but in order to be able to credibly report back and work collaboratively and engage the different stakeholders, there needs to be an infrastructure that's supported and has consistent support and that's credible. In the initiation of this evidence-based practice, it was clear that the legislators didn't have a great deal of trust in the data that was coming from the various departments around effectiveness. So bringing an outside entity, be it a public policy institute or a university, into the mix really enhanced the credibility and belief in data. And I'm not sure I'm answering your questions about capacity, but certainly having external voices around how data is looked at and how credible it is certainly has an impact on ongoing support and sustainability.
Mm-hmm. Yeah, I mean, we talk all the time, even though I am the resident research and evidence-based policy initiative person in the Governor's Office of State Planning and Budgeting, and I have a teammate, we're only 2 people, and we say all the time that evidence-based policy is not just a function of our office, it's a function of every branch of government. It's the state agencies, it's the legislature, it's nonprofits that work in our communities, and so we've actually done a lot of stakeholder engagement outreach, and we've formed kind of this organic EBP collaborative which consists of our office, people from state agencies, people from universities, people from nonprofits, and we kind of all are out there talking the talk. And even though we don't have this state standard of what that means, right, we all kind of have our piece to play, and we have our piece in the puzzle, and we're always plugging into different people throughout our networks and our communities. And so we've kind of naturally built that capacity, but it definitely takes more people to do the work.
Yeah, what I would say is the ultimate quantity of resources and what the breakdown is between in government, contracting out, universities, nonprofits, I'm not really sure. I think as a general rule, or I would say we need a lot more of all of those, and a lot more investment on the in-house government side as well. These are not mutually exclusive. This is my earlier point that if we get that right, the other elements are just going to be better leverage. There's just going to be more to sort of facilitate. The other thing I would say is that, we've talked a little bit already about some of the bureaucratic changes that need to happen. I think there's a similar conversation that needs to happen on the academic side. And so whenever I put my other shoe on and I'm talking to my other faculty colleagues, I think we as academics underestimate how much our research, our inventiveness is going to be improved by going out into the field. This basic versus applied distinction that people make, I think, is way overblown. And what I would say to academics is just study the history of science to make this point. Look at World War II, look at Bell Labs, look at all of these different periods. It's a space race where there are highly implied endeavors that to solve them, we had to invent so much stuff. So I think it will be good for scholarship too, but that's going to require some changes at the university. And so we should have that conversation jointly.
Great, thank you for your thoughtful questions. To close out the panel, I'd like to start with David, and just in a kind of rapid fire response, if you will. What are the top 2 or 3 components to advance the use of evidence and data at the state level?
Oh. Well, we've said a lot of them so far. I do agree with Sarah's point that everybody, no matter where you're at, can just start asking this question, do we know this works right now? And really pressing on the what's the counterfactual? So in government, it's always common to be looking at metrics over time, and that's fine if you're doing a pre-post thing, but pressing people to clearly say what would have happened had we done something differently, if just everybody says that always, everywhere, that alone would be a nice little culture change.
Yeah. Eric.
I think figuring out ways in which to support the implementation of evidence-based practice. I think that it's a resource issue, and many of our funding schemes and the structure of Medicaid and the Title IV are not really designed to support these activities. So coming up with strategies to use federal and state dollars in more flexible ways.
And Jessica.
They took my 2 answers, culture change and funding.
There you have it.
Big things, yeah.
Great. Thank you. Thank you so much, and please join me in thanking the panelists.
Well, thank you all for the great discussion just now. So I have to say I'm actually pleased to hear so many questions from folks who work for the federal government in a conversation about states. So it's just a good example of cooperative federalism in practice. In reality, we know there are a lot of states that are intricately interested in moving this topic forward. You've just heard from 3 great leaders across the country. Kira was actually just at the National Governors Association summer meeting last week, and innovation and issues around data use were recurring themes that came up throughout the event. So from the top level of governors' leadership all the way through the folks that are sort of on the ground doing some of this work, we know there is a lot of work to be done, and maintaining the interest in the topics is going to be really important. I would like to stress that this is hard and takes time, and I think these folks have sort of highlighted many of the issues, and Sarah's research has highlighted many of the challenges that states face in going forward. And what struck me in the conversation today is just how similar some of these challenges are at the state level to what we see at the federal level. And not to plug the Commission on Evidence-Based Policymaking too much, but I think a lot of the recommendations that the Commission highlighted at the federal level are just as relevant at the state level, and would really encourage that we think about that application going forward. I want to highlight one thing before you all walk out the door. What can you do? You've heard a lot of suggestions through the discussion today. I think there are a handful of things that came up multiple times. Ask questions. Does this work? Collaborations and partnerships are going to be really essential, and that may require us to change the models that we use for implementing some of our programs. Encouraging policymakers to actually develop the policies and practices to support this work and the basic infrastructure to engage in evidence-based policymaking. If you find a good leader, don't let them leave. David, I hope you don't ever leave the DC lab. I'm sorry. Developing communities of practice, making sure that researchers and people who are interested in this topic are connected across government agencies, nonprofits, is essential. And being able to explain what the heck we're doing is really important, whether it's developing stories or cases or just a narrative that is accessible. These are all really basic strategies that we can engage in today, and I encourage you all to begin to do so. If you'd like to learn more about the Bipartisan Policy Center's work around evidence, I encourage you to visit our website, bipartisanpolicy.org/evidence. I'll just put in one last plug for David's website, thelab.dc.gov. All right, I got it right. And I just want to say thank you to all of our panelists and to Pew for co-sponsoring this event, and to all of you for joining the dialogue. Let's keep the conversation going. Thank you.